Good afternoon, everybody. Am I audible? So I was, as Shikha was telling the guidelines for the civil society organizations, I thought we are already doing everything, or maybe some of the things. By our instinct, or I have been a person living with NCD, rather celebrating the life with cancer. And I've been a survivor and thriver. And Sahayata, I think Sahayata has changed the narrative of negativity of NGOs in Chandigarh. I can proudly say that because whenever somebody talks about Sahayata, it is with the credibility and not negative, but positively. And we are getting donations without even asking sometimes. Patients come and survivors come and give heavy donations to us. And we are doing awareness. We are involving youngsters, NCC. We are into all the schools for tobacco control. We do competitions for no tobacco, every word no tobacco day. And the response is very good from the children's side. We do awareness with NCC. And we are doing awareness in Panchkula, Chandigarh schools. Punjab we have to cover now. And we are doing this awareness for cervical cancer, and we are into this vaccination also, along with jointly with Rotary. And we do patient care also in PGI for the past 25 years. And we are doing holistic help with the medicine, emotional help, information, and even after the death of the patient, we do rehabilitation for the family. So I must congratulate Dr. Rakesh for coming with these guidelines. These are very valuable, and to have combined efforts. This is advocacy and combined efforts, and I think we should, we are concentrating on cancer only, NCD cancer only, not other. But we must have advocacy for the national policy on cervical cancer vaccination. So we must do that effort because that is preventable. So we should work about that, and tobacco control. These are the main, we do breast cancer awareness, and we do pink walk also, and we are into so many things. I've got my brochure here. So thank you so much.
Next, we have with us Mrs. Vandana Saxena. I welcome you, ma'am. Ms. Saxena has dedicated her 30-year career towards transforming the education system in India. I request ma'am to please share her insights with us.
Good afternoon to all present here. I represent a single project. The project's name is the Tribune School. And we are a philanthropic initiative of the Tribune Trust. And most of the children who come to us are first-generation literates. And after COVID, the new education policy was released simultaneously, and they spoke about the importance of literacy and numeracy. However, in our school, we realized the importance of mental health. And I, along with my very competent team, Mrs. Nikita Dwivedi, who's a counselor and a special educator in our school, and the two girl students who are present over here, we are working on mental health. And in the 2 years, we dedicated every initiative in school on mental health in school. While we were talking about happy streets in Chennai, I invite you to a happy school in the heart of the city by the name of the Tribune School. We have seen a visible change not only in the smiles in the children of a school, but also the teachers. There's a lot of focus upon providing support to the teachers and the parents through the parenting sessions that we hold at school. They're very close to my heart because mental health is the foundation and the basis of every institution. And if you have good mental health, everything else becomes possible. Numeracy, literacy follows only if children are happy in class and they are fearless, and that's the only way they learn. Along with that, I congratulate Hriday and Sipher for this wonderful initiative. I am living at home with my mother-in-law who's diabetic and both my parents who are stroke survivors. So I'm aware of challenges and would like to learn a lot. And capacity building can begin right from here. I'm a very strong contender for that. And with Dr. Rakesh Gupta, we gave a special meaning to Diwali celebration at school this time. The first initiative that we worked with in our school was, there's a campaign on avoiding cigarette smoking, which was a great initiative, and Dr. Rakesh Gupta supported us. And at Diwali, this time, while every year in schools we talk about anti-crackers, and so this time the meaning that we gave to Diwali celebration along with the Ramayana and everything else was a lot of discussion about anti-smoking and anti-tobacco initiatives that were kind of not culminated but brought to highlight. So I believe that if schools can celebrate with a purpose, things happen and magic begins to happen. Thank you very much for having us here. Thank you so much.
Thank you so much, ma'am. Now I request Dr. Rakesh Gupta to lead all the respective guests, and we will release our guidelines on meaningfully involving people living with NCDs and CSOs in Punjab's NCD and UHC action plans. So please.
You can now please hold this. नजदीक सारे वीडियो ले लेना. Thank you.
Next, I would like to welcome Dr. Anand Gupta. Dr. Anand Gupta has over 14 years of teaching experience after post-graduation, and sir is here presently working with us as Associate Professor and Maxillofacial Unit in charge at Government Medical College Hospital in Chandigarh. So please,
Hi, good afternoon. So thank you very much, Dr. Gupta and the organizing team for inviting me to be a part of this gathering. And I'm feeling very elated when I see the all presentations like the participation of all the people from civil society and the patients and the stakeholders, and we being a surgeon who takes care of like those patients who are suffering from non-communicable disease becomes very important. And such type of forum is, I think, is one of the few forums where you take like the stakeholders all are there and you decide how the guidelines are made. It's a very important part. And myself being a cancer surgeon, we do more of head and neck surgery than oral cancer. And we know India is said to be the capital of oral cancer in the world. So it's not a matter of pride, but to be said, we are having such a high burden of oral cancer and the disease which is actually preventable. And we know tobacco is the main etiology, and we have seen, like, I'm talking with Dr. Gill and seen all of like the NGOs, they are working hard for tobacco control, but we feel a lot of challenges. Like we do a lot of cancer surgeries, we have a lot of referrals. There are not so many surgeons who do head and neck cancer surgery because you need reconstruction, you need a team. You don't need to remove the tumor, you need to give them back to the life. And the good part of the stakeholder, like we are doing a research like on that, we operate a patient and we want to see what is the quality of life after that. It's not only we save the life. When we have audited our data, we found there's a high increase in the young people are having oral cancer. You see a lot of people in the vendors, they are eating a tobacco, like a smokeless tobacco, gutka. They are 19-year-old, 20-year-old, they are having a cancer. If they have a cancer, though they survive, they have a long life to live. And these are the people who are the bread earners for the family. And you see, if one patient has a cancer, a lot of money is spent, and that person, if he is not able to come back to the working life, then whole family goes in debt. And like the society, a lot of organizations are there to help those people, and we feel a lot of crunch, like sometimes very expensive. Patients can't afford. We try to get funds from many people who are from out of the India. They support those people. And I would like to meet more of the NGOs here, those who support, like Sahayata, the madam has told. So we'd be very happy to talk, because these patients are really poor. They are a migrant population. They need our support. And the prevention is very important. We know that tobacco can be prevented. So such type of meetings, such type of people, I think will make a difference to those lives. And we do feel a lot of challenges in operating those patients. And these one patient, I need to operate around 8 to 10 hours, one surgery. So you can believe like 10 hours spent on one patient, and that patient again have a cancer. It's so bad. Like recently I operated many cancer patients. Many fail. Like there is a 50-60% survival, 30% though fail. One patient I saved him 6 to 7 years back. I was very happy. He was doing very well. The old patient coming from Punjab. He came after 7 years. Of 8 years, he is having the cancer. I asked, and I come to know that he was still smoking. He was still like chewing the tobacco. I don't know. His wife was like, I was so like, what are you doing? I saved your life, spent so much of time, and you are still smoking. So tobacco control becomes so important, even though you treat those patients. So sir, thank you very much. So it was a nice gathering, and interacting with all of them, I will have like more support for my patients. Thank you very much, sir. Thank you.
Thank you so much, sir. Next, I would like to invite Dr. Kirat Sibia, MD Pulmonary Medicine. Ma'am is consultant pulmonologist and head of critical care at Bahara Super Specialty Hospital. I request ma'am to please share her insights with us.
A very warm good afternoon to everyone present here. Thank you, Dr. Gupta, for having me here. And I would like to say that this is one of its kind initiative, in the sense that I'm more used to having conferences and continued medical education programs with more physicians around. But I'm so happy to see that the public stakeholders are having such an active role. So I think it is very clear that the secret to a country's health lies not in its healthcare systems, but in the homes of the people. And the fact that more and more people are actively being involved, or we are recognizing the role of the people who are living with communicable diseases and the families and the caretakers, It is an evolution in our overall understanding of healthcare. And there's definitely a big, there's an unmet need of education and improving the access to the overall care that people require at home. I feel when I see patients with non-communicable diseases like, COPD, emphysema, bronchiectasis, there are a lot of lung, and even lung cancer, a lot of diseases related to lung are treatable, manageable, livable with. But definitely it's a huge burden for the patient and the family. But I wish we could look at it as a mountain that they are not supposed to carry, but a mountain that we are supposed to climb together. I would like to just add here that physicians are the point of contact when it comes to diagnosing a patient with a disease. Then the patient comes to us again and again while the patient is living with the disease. The family has its own apprehensions. And I'm very happy that you're talking about even educating the caretakers, because there is such a thing as caretaker burnout. And yes, mental health is very important, because people living with chronic diseases are very, very prone to more diseases like depression. And I'm calling depression a disease, not just a comorbidity. So understanding all this, I would like to just add my quick pointers here. That is that involving more and more physicians mean that we can have more and more points, sources, or places of screening people. Even people who walk in with the disease and their attendants can be screened. And we can actually increase awareness amongst the physicians regarding the services which the patients can avail. For example, I have today learned so much about what the services are being provided by the civil society organizations. I remember the last meeting I had with Dr. Gupta. He was organizing this national level Sipher meet on tobacco cessation, and we had experts from all over the country. It was done a few months back. It was very impressive, that meeting. And what I learned was the role of policy and what the rights we have. He talked about something as simple as how a shopkeeper should not be displaying a lighter, and how it is actually something that the law can take action. So if we are aware that they are not supposed to display lighters, and if they're selling bread and groceries, they can't be having cigarettes at the same place. And it is such a common practice. We come across it on a day-to-day basis, but we don't seem to even know that this is actionable. We can report this. So that was an important take-home point for me. And even tobacco cessation. That is the next step. The first step is that I did not even know that this is actionable. I'm just talking about my ignorance as a physician. I understand disease, I understand what medical treatment I can give, but there's a limitation to that. It has to be holistic care beyond that. And I would like to take this stage to create awareness regarding pulmonary rehabilitation. People who are even dependent on oxygen, they are candidates for pulmonary rehabilitation. To make it as simple as that, anyone who feels that their level of daily activity they are not able to achieve because they are living with a certain disease, they are candidates for rehabilitation. Forget all other definitions and terminology and criteria. So anyone who can't live to their desired level of daily activity, and the disease is the impeding factor, they are candidates for rehabilitation. And it's not just when we're talking about pulmonary rehabilitation, it's not just that we are talking about lung exercises or equipment. We're also talking mental health. We're also talking diet and nutrition. We're also talking prevention. If somebody else is smoking in the house, they're putting that person further at risk. There's so much we can talk about on this topic. I don't want to go further and take more time. But I do want to talk about non-communicable diseases are leading to communicable diseases. How is that? Dr. Gupta just talked about tobacco and tobacco chewing and oral cancer. May I interject and say that People who chew tobacco, they spit here and there, and they are spreading tuberculosis. India has the largest tuberculosis burden in the world. So people living with non-communicable diseases are also spreading communicable diseases. People who are diabetic, they are more prone to diseases like tuberculosis because their immunity is compromised. So they catch a disease which is communicable, and it goes on and be spreading disease. So I would like to end here. I'm so happy to see children participate, and ma'am from Tribune School, she spoke so beautifully about mental health. I was just thinking in my head at that time that we have spent the maximum years of our life learning at school. Yes, like MBBS is 5.5 years, and MD, and like that's another thing. But definitely the most primordial years, the years when children are amenable to learning, impressionable. I wish we had gyms in our school. We just don't have that concept of fitness. Mental fitness and physical fitness, because these children of today are going to be tomorrow's future. And if we can prepare them to be strong physically and mentally, we are actually leading to a truly healthy alliance. Thank you so much.
Thank you so much, ma'am.
I think we are already getting late, so we have to stick to that 2-minute schedule for all.
Okay. Next, I would like to invite Dr. S.P. Surila. Sir is from Society of Nutrition, Education and Health Action. I request Dr. Surila to share his insights.
Thank you, Dr. Gupta, Dr. Thakur, for calling me, inviting me for this very elaborate and informative platform. I am Dr. S.P. Surila. I retired from the Government Service Punjab Health Department in 2012. I worked in tobacco control, awareness and other things since 1980. So in all, it is 42 years. So after retirement in 2012, I am still continuing with this task. Of course, with the help of government sectors and my colleagues and NGOs. So we are one of the initiators who took initiatives for this tobacco control since 2006 in a planned way. So International Union and my colleagues and Dr. Gupta and others, we started this work making Punjab as first tobacco smoke-free, Mohali, then Mansa, and then whole of Punjab. So now I have learned a lot because we can do other things also. Tobacco is one of the factors which cause this NCD. So I think we should have continued it along with it, tobacco control. But now, after retirement, I am participating in these workshops, then these seminars, and then different talks in the schools and universities. Recently, we have started eye dispensary in Patiala district. So there we do this NCD work. We take the blood pressure, the diabetes. Here a medical officer never goes there. He is on this online services are given. So our paramedical staff goes to the village. That is a rural-based program. So there we give the services of this medical consultation and other assistance. We don't give the medicine to the patient, but we give this consultation about all the this medical care. So this is our presently the tasks we are doing. And of course, I learned a lot in this workshop, and I will continue giving these services. I am also running one NGO named Sneha. So we are also working for the same health education and tobacco control program. Thank you.
Thank you so much, sir. Next, I would like to introduce Dr. Ravindra Khewal. He is a professor at PGI Chandigarh. Dr. Khewal's work focuses on understanding air pollution, its sources, and its adverse effects. I request Sir to share his experience in highlighting air pollution as a risk factor for NCDs and also the need of multi-stakeholder engagement in this. Sir, please.
It's a pleasure to be here. And what I wanted to talk about that just 2 days before, the air quality index touched 400. It's fine. I can speak loud and other can hear also. Yeah. So, okay, sorry. So, just 2 days before, the air quality index was 400. You know, if it is just had 401, we could be in the severe category in Chandigarh. Means you were be living and breathing the air quality which we see in Delhi. So think about the air quality being deteriorating, and then people with the non-communicable disease, how they will manage. So such guideline, when we see that meaningfully, basically involving those who have NCDs, and then how to engage them so that their health improve. Otherwise, what we hear that those who live in Delhi or polluted area, they lost certain life years. So if we need to think about, means how through various changes, engaging those who are suffering, those who are providing care, and those who are advocating for them, they all can work together. And considering this, basically we work in this direction. So like you talk about air pollution, so how from awareness to action we can engage, and not only the children but the common men. And this is what we are working for. And you might be aware that COP27 is going on. And when we talk about COP27, basically we need to understand that how in the changing climate we will survive. I hope you remember that the temperature was, we agreed that we will restrict it to 1 degree, and it is already now 1.15 degree increase. And remember, if it is increased to 1.5 degree, the global average temperature, there will be a disastrous consequences. And then thinking about people with NCD, you can understand how serious will be the situation. And this is why we are doing certain, you can say, awareness work. Like this one is on plastic. Can we take it down, please? It's not going here. From here. थोड़ा थोड़ा नीचे ले जाइए इसको. I wanted to show other document also. So what we want to show you here, that this is, can we reduce it? Yeah, like this. Yeah, go down please. So this is like about plastic, how we can play our role. The another one is the Government of India adopted and released this document, where basically from awareness to action, how we can play our role. Next please. And next please. This is, yeah, this is the one which is available, which you are not able to see here, but it will come soon, is the Kids, Vayu and Climate Change. So we have written the 10th comic series for children, engaging them, and not only the children, basically the public. And this is available in 22 vulnerable languages. The international translation is going on. So these kind of effort means how, because the people with NCD, they are at higher risk during the high air pollution episode or high temperature, and then how they can save themselves, these are discussed there. And I think looking at the time limitation, I will stop here, and once again thanks all the organizer for inviting me and introducing our work. Thank you. First two comics are also available on Government of India website. Like our first comic, Kids, Vayu and Corona, was released on 9th March. Whereas the WHO released their guideline how to talk about COVID-19 to children on 26th March. So you can think that how the Government of India and their associate are leading the effort. We'll share the link with you all in the group.
Today we have with us Mr. Saudagar Singh from Sneha. I would request sir to share a few insights with us.
ਮੈਂ ਕੋਸ਼ਿਸ਼ ਕਰਾਂਗਾ ਪੰਜਾਬੀ ਚ ਬੋਲਣ ਦੀ ਕਿਉਂਕਿ ਅਸੀਂ ਜੋ ਫੀਲਡ 'ਚ ਕੰਮ ਕਰਦੇ ਹਾਂ ਪੰਜਾਬੀ ਦੀ ਜ਼ਬਾਨ 'ਚ ਹੀ ਗੱਲ ਕਰਦੇ ਹਾਂ। ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਮੈਂ ਮੰਚ ਤੇ ਬੈਠੇ ਸਾਰੇ ਆਫੀਸਰ ਸਾਹਿਬਾਨ ਦਾ ਧੰਨਵਾਦ ਕਰਦਾ ਕਿ ਸਨੇਹਾ ਜੋ ਸਾਡੀ ਫੀਲਡ 'ਚ ਕੰਮ ਕਰ ਰਹੀ ਹੈ, ਸਾਡੀ ਇੱਕ ਡਾਕਟਰ ਸੁਰੀਲਾ ਸਾਹਿਬ ਦੇ ਰਹਿਨੁਮਾਈ 'ਚ, ਉਸ ਦੇ ਵਿੱਚ ਅਸੀਂ ਵੱਖ-ਵੱਖ ਸਿਹਤ ਨਾਲ ਰਿਲੇਟਡ ਕੰਮ ਕਰ ਰਹੇ ਹਾਂ। ਅਸੀਂ ਪਲਸ ਹੈ ਜੀ ਲੇਬਰ ਚੌਂਕ 'ਚ ਜਿੱਥੇ ਐਂਟੀ ਸਮੋਕ ਤੰਬਾਕੂ, ਅਸੀਂ ਫੀਲਡ 'ਚ ਜਾ ਕੇ ਸਾਡੀ ਕੋਸ਼ਿਸ਼ ਹੈ ਕਿ ਉਹਨਾਂ ਲੋਕਾਂ ਨੂੰ ਮਿਲੀਏ ਜਿਨ੍ਹਾਂ ਨੂੰ ਲੋੜ ਹੈ। ਅਤੇ ਹਰ ਸਾਲ ਅਸੀਂ ਜਿੰਨੇ ਵੀ ਲੇਬਰ ਚੌਂਕ, ਮਾਈਗ੍ਰੇਟ ਪਾਪੂਲੇਸ਼ਨ ਅਤੇ ਮੰਦਰਾਂ ਦੇ ਵਿੱਚ ਜਾ ਕੇ ਅਸੀਂ ਜੋ ਉਹਨਾਂ ਦੇ ਹੈੱਡ ਉਹਨਾਂ ਨੂੰ ਸਮਝਾਉਂਦੇ ਹਾਂ ਕਿ ਭਾਈ ਤੁਸੀਂ ਜੋ ਵੀ ਤੁਹਾਡੇ ਕੋਲ ਆਉਂਦੇ ਉਹਨਾਂ ਨੂੰ ਐਂਟੀ ਤੰਬਾਕੂ ਬਾਰੇ ਦੱਸੋ। ਜਿਹੜਾ ਕੈਂਸਰ ਹੈ ਉਹ, ਕਿਉਂਕਿ ਜੋ ਸਾਡੀ ਗੱਲ ਨਹੀਂ ਮੰਨਦੇ ਲੋਕ, ਜੋ ਧਾਰਮਿਕ ਆਗੂ ਨੇ ਉਹਨਾਂ ਦੀਆਂ ਗੱਲ ਬਹੁਤ ਜਲਦੀ ਮੰਨ ਕੇ ਉਹਨਾਂ 'ਤੇ ਅਸਰ ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰਦੇ ਹਾਂ। ਸੋ ਮੈਂ ਬਹੁਤਾ ਕੁਛ ਨਾ ਕਹਿੰਦਾ ਹੋਇਆ ਅੱਜ ਬੜੀ ਖੁਸ਼ੀ ਮਹਿਸੂਸ ਕਰਦਾ ਡਾਕਟਰ ਗੁਪਤਾ ਜੀ। ਮੈਂ ਇੱਕ ਬੇਨਤੀ ਕਰਨੀ ਚਾਹੁੰਦਾ ਕਿ ਸਾਡੇ ਫੀਲਡ 'ਚ ਜਾ ਕੇ ਤੁਸੀਂ ਆਪਾਂ ਲੋਕਾਂ ਨਾਲ ਜੋ ਇੱਥੇ ਹੈ ਉਹ ਪਿੰਡਾਂ 'ਚ ਜਾ ਕੇ ਰਾਬਤਾ ਕਾਇਮ ਕਰੀਏ ਤਾਂ ਕਿ ਜੋ ਸਾਡੀ ਲੋਕਾਂ ਤੱਕ ਜੋ ਲੋੜ ਹੈ ਅੱਜ ਸਮੇਂ ਦੀ, ਕੈਂਸਰ ਬਹੁਤ ਫੈਲ ਰਿਹਾ। PGI ਜਿਵੇਂ ਜਾ ਕੇ ਆ, ਬਹੁਤ ਗਲ ਦਾ ਕੈਂਸਰ, ਸਾਡੇ ਇੱਕ ਪਦਮਦੇਵ ਸੂਰ ਸੀਗੇ, ਉਹ ਪੀਂਦੇ ਨਹੀਂ, ਸਿਗਰਟ ਵਗੈਰਾ ਨਹੀਂ ਸੀ, ਪਰ ਉਹਨਾਂ ਨੂੰ ਵੀ ਗਲ ਦਾ ਕੈਂਸਰ ਹੈ। ਸੋ ਮੈਂ ਬੇਨਤੀ ਕਰਦਾ ਸਭ ਨੂੰ ਕਿ ਅਸੀਂ ਪਿੰਡਾਂ 'ਚ ਨਿਕਲ ਕੇ ਲੋਕਾਂ ਦੀ ਅਸਲੀ ਸੇਵਾ ਕਰ ਸਕੀਏ। ਇਹ ਮੇਰੀ ਬੇਨਤੀ ਹੈ। ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ, ਸ਼ੁਕਰੀਆ, ਧੰਨਵਾਦ।
Thank you so much, sir. Next, I would like to welcome Dr. Ms. Daman Mangat. She is a hospital volunteer and is associated with Sahayata Charitable Welfare Society. I request ma'am to please share her experiences with us, as well as I would like to ask a question, ma'am. Is there any support needed by those living with NCDs, including cancers, to access prevention and control services such as subsidies and travel, ma'am? I'll repeat. So, ma'am, I would like to ask you, is there any support needed by those living with NCDs, including cancers, to access prevention control services such as subsidies and travel? So, if you want to.
Good afternoon, everybody on the bench and my dear friends. I'm a 70-year-old person, and I have survived through this cancer of cervix for the last 28 years. I'm one of the first good cases of early detection, and it's cure in time, caught in time, because we have to give ourselves, take care of our health and all, and that is it. Her question was that what do? We are talking about travel. I'm very happy with Himachal, Haryana, Punjab. We were the people, pioneers, our NGO called Sahayata, to bring in the discount or the free travel for passengers up and down from their hometown till PGI. We work in 2 hospitals. One is 32 horse JMCH and in PGI. We work in the oncology department. We work in all the departments because all types of patients come to us. And basically, now we are very proud, PGI, to host that. We have very good team of oncology. We have a different this thing. Now, this travel in Punjab was the first thing we got it done. But now it's going down, and people are having a lot of problems. We tried the same thing in Haryana. They have got a very good system. We write a letter to them. They take the form to the CMO or the civil surgeon of like Kurukshetra, जहाँ भी वो होते हैं, वो उसका ले जाते हैं. And then those people looking at their record make a pass for them for a year, which is very convenient, and they can travel up and down. Himachal has its own, they have their own pink slips. They bring up and down, they go, but yes, we are there to fill the forms. They want something from the PGI, and we are sitting there, and our team of volunteers sit from Monday to Friday, every day for 2 hours in these departments, and new OPD, APC, and that is where we help them with Ayushman, with the various funds, with various yojanas, जो हमारे आजकल यहाँ मतलब सरकार हमको देती है. We have even employed girls from our NGO to help them filling in the forms and doing the rest. Talking about myself, I got detected in '94, and like I told you, I was a case of early detection and in timely, caught in time, and I was helped at that time by the HOD, Dr. Kamla and Gyanendra Dhal. They were our gynae heads, and they guided me. And to my good luck, we had the best surgeon in India, Dr. M.R. Kamath, head of gynae and gut from Tata, visiting us for a conference. And I got my appointment and I was operated. Because I was a case of early detection, Dr. Kamath advised me that I don't need any chemotherapy, no radiation. So I didn't have to go through any of these things. So, I mean, it was a clear case of extensive surgery, Verdheims, I think you all understand. And everything, my reproduction system was cleaned out totally. And that is what it is. Till today, I have no problems. And I keep myself very busy and active. Along with my cancer, which I survived, I am a case of a high risk of heart patient. I have 2 stunts. And I mean, people have different theories, but because I was operated at the age of 41, I had to take, they advised me to take HRT, and I took HRT for 9.5 years. Then again, I became a high risk of breast cancer, which you all understand. But God has been kind, so I didn't have anything to do with that. Though we do a lot of, try to take our mammographies in time and pap smears and everything. Now I work with this NGO, Sahayata, Charitable Welfare Society, and I am their public relation officer. And it's easy. I feel that we should think positive and put this positivity in the patients also. When we sit there every day, that is all we have to do. We give them free medication. We give each child of the patient, we are giving, because they're all poor patients, and we are giving 200 rupees per month for their education also. They may be from, and we get patients from all over. We have had patients from Patna, Calcutta, UP is full. We get Haryana, Himachal, and Srinagar, Punjab, of course, we get a lot of patients from there. And my advice to all is that listen and look for changes in your body. Always see कि कुछ गड़बड़ तो नहीं है ना, and do not ignore and consult the doctor immediately, because early diagnosis, that is, I'm a true case, and correct treatment at the right time will help you recover as soon as possible, and you'll have no problem. Also, I feel that survivors, we survivors are special people and has so much to give to others who have to go through this trauma of cancer. To remove the stigma of cancer fair, because these days most of the cancers are curable if detected in time. So that is what we do. We go to schools, colleges, and various institutes. I've been to RBIs, banks, everywhere. We go as a team and we go and advise them. We give a lot of awareness to them so that they can catch. I just want to tell you one case. There was number 2 head of RBI. She had this awareness at her, in the bank, in the RBI, the main office. We went and told her. And told her, we gave the awareness in RBI. And you won't imagine that she felt the lump. She went to the doctor. She was in Fortis for 2 months and she died. And after that, all the girls, everybody was so aware that they came back to us, asked us a lot of questions. She was number 2 in RBI. And I think South Indian girl. And she suffered a lot. It was one of those galloping type of cancers. And of course, my aim in life now is to help patients fight the big C with courage, not without courage. And the patients after treatment are survivors, thrivers, and finally we should all contribute to the society. Being blessed to reach out to patients and help them and take out their fares. She wanted to know what time I started she said, did I start my social work after my cancer? No. I started my social work at the age of 13. We had this big war in 65, Pakistan, India. I'm an army officer's daughter. That schools were closed and we were sent to command hospital to help. Somebody wrote letters for the Jawans. We were posted in Pathankot. Some people read books or something. But I was the one who wanted to help the nurses to clean burnt wounds. Burnt wounds, doctors understand, is a very, bad wound. So from that day, it just came into me. And my mentor is my mother. She's the one who has taught me to give selflessly to everyone. That's all. And of course, I want to say, जीने क्या राज मैंने सहायता में पा लिया, जिसका भी गम मिला अपना बना लिया.
Thank you, ma'am. Due to the time limitation, I request our next speakers to please be brief about. Our next speaker is Mr. Rajiv Chaudhary. He is Project Coordinator, PGI Chandigarh. Sir has over 15 years of experience in health sector. I request Sir to please share his insights with us.
Thank you. I try to make it very short. Thanks to Dr. Rakesh Gupta sir and Hardev for giving this opportunity to share what efforts we are doing in tobacco control. So I start with the statement of Dr. Anand mentioned in the last line that we need to work for tobacco control a very grounded level. So we are doing our efforts as an academic institution. This resource center is established at PGI Chandigarh with the joint effort of the union and PGI. And we are working from year 2018 till this 4 year, we have successfully organized various events, almost 32 plus workshops, training in last 4 years to educate the people on various thematic area of tobacco control. Even we organize few specific theme-based webinar for the audience, for the school child, for the school, school principals from the across country, not limiting to Punjab and Haryana. We will organize various state-specific orientation workshops as well. So we also organized 2 big-level national summit, and that also including all thematic area of tobacco control, which starting from the awareness till the technical medical area to discuss during these. And when one also organized one national conference, NCTOH, last year. And that is also one successful event in a country. This is the 5th NCTOH. And the last 4 NCTOH organized at Tata Memorial Hospital, Mumbai, and this 5th one organized at PGH Chandigarh. And almost 1,000 plus audience across the country joined this particular event. And that is also one of the successful event we organized during this. This is actually the direct intervention we are doing. And we are continuing doing our these type of webinar and workshops. In the series of that, we are also planning like one very specific webinar on 23rd of this month. Basically, that is on tobacco vendor licensing. So that we try to cover all type of themes in tobacco control, whatever way we are using to control tobacco consumptions and harmful effects. We are doing our efforts through this resource center. And beside this, we are also organizing various one-to-one sessions wherever we get this opportunity. And also, we are trying to collaborate with the various networks to have these type of activity to be continue and providing some resources to them for having the awareness and all capacity building to the stakeholders. So, and the last, I agree with the Upendra ma'am statement that he mentioned that we need to build the network from now. Like this NCD control is a very wide area. So we need to include all type of stakeholder. This is not a job for public health experts, yeah, for the teacher, for so we need to include all type of stakeholder to this, and we need to work and start from here only to continue for the whatever limit to these preventions. So that is from my side this time. Thank you, ma'am.
Our next speaker is Ms. Nikita Dwivedi, Senior Teacher, the Tribune School. I request ma'am to please share her insights with us.
Thank you. Very good morning to all of you. My name is Nikita, and I don't know how God made its way for me to be here. Given for adoption at 2.5 years, and when I met my biological parents, I lost them due to cancer. Recently, one on 17th of April, because cancer was diagnosed at the last stage. So, and again, having a daughter who is suffering from allergic rhinitis and maybe suspected to have COPD, still working on it. So here I am representing the Tribune School, working with the organization for the past 8 years, working on the mental health as Vandana ma'am has shared. So we have involved students in this project. It all started with a session wherein we invited Dr. Rakesh to our school. And even I was not aware how I am going to proceed it further. We focused on the mental health of our children who are the first generation learners. And as ma'am said, that mental health is the most important thing in the world, because I myself have suffered from it. It is not easy for the family also who stays with a person who is suffering from cancer. It is very difficult for the family. And I have attended many seminars, workshops, but I must tell you honestly that this one will be the closest to my heart. And as it is mentioned, Hriday. So I felt that everyone who is present here spoke from their heart. So Hriday is well mentioned, and I'm very thankful to the Sipher who have involved us in this project. And as Shikha ma'am said that they are distributing reading materials, so I would be very thankful if, because we are not from the medical field, so if reading materials in some simple language could be shared with the students, because these are the future, and if we sensitize these children that yes, tobacco is a menace, we have to curb it, alcohol, smoking, we have to stop it right here. So then maybe the people like me, when they grow up, they'll have a family. That's all I would like to say. Thank you so much.
Today we have with us two youth representatives, Ms. Kashish Tiwari and Ms. Aditi Pushpakar. I request both of you to please share your insights with us.
Good morning, one and all present here. As my favorite teacher Nikita ma'am said that mental health is the first priority, and for students also, one thing I noticed that nowadays students are saying, "Yaar wo chala gaya, yaar ye chali gayi, I am in depression, I am in this." This is not for students. Actually, we must be happy for our future also. Like depression is also very bad for our studies and our for future also. If the students will be in depression from nowadays, they will not survive in their future. They will be afraid of the problems which they have to face in the future. So I will tell every student or motivate them that depression is not the thing we have to focus on. We have to focus on our future and our career. Thank you.
As tribunians, we are taking regular initiatives towards proper and awareness of these NCDs, because it's not something that this age group will only suffer from these diseases. So we are regularly taking initiatives like we are awareing children that what are NCDs and what are the causes like tobacco use, because we are the future generation. If we will fall in this trap of these drugs and tobaccos, like the future will be destroyed. And we are taking out rallies, we are making posters, and there are many children from our school which are really serious, and I think all of us, the students of Tribune School, are really serious, and they are showing equal participation in all the activities. Thank you. Sir, I think like there are many people in our country are going through this hard, because even in my colony, there are many people who are suffering from heart attacks, stroke and everything. And I think it is a big problem in our school, in our country, that every day we are hearing that he have got a heart attack. And I think AIMS Delhi is a really big
Sir, because in 2021 in January, my mother lost my father due to some brain problem, and after 2-3 days, my mother lost her uncle also due to some brain problem. So she suffered a lot from that. I recognize that brain problems are also very big in our country.
Next, I would like to invite Dr. Rakesh Gupta. He will be introducing our guest of honor, Professor J.S. Thakur. So please.
So we have with us Professor J.S. Thakur. He is Professor of Community Medicine in School of Public Health, PGH, Chandigarh. And moreover, he is President of the World NCD Federation. And they'll be holding a conference in Toronto in June. So he has got teaching and training of, his teaching and training, Master of Public Health students, MD, Community Medicine and PhD students. And he has an international and national consultancy to Southeast Asia region countries, including Sri Lanka, Maldives, and national and state government in India in matters related to policy, program development, and advocacy for prevention and control of non-communicable disease. He is the most well-known personality, I think, nationally as well as internationally on NCDs. He has done an extensive work on urban marginalized communities and implementation of the national health programs in northern Indian states. And he has developed the proposal for satellite centers of PGI at Sangrur. So you must be knowing about it. We have a satellite center for PGI in Sangrur and Firozpur in Punjab. With satellite center at Sangrur is under construction. Firozpur has already been approved by MHFW New Delhi. And he has contributed in developing partnership between PGI, Tata Memorial Hospitals. So we welcome you, sir.
So thank you very much, Dr. Gupta, for this liberal introduction, and I acknowledge the presence of my colleague, Dr. Vindra, Dr. Surila, a very old friend, and many of the people who are quite familiar in this audience. I think the meeting which is being organized is very relevant, that what is the role of civil society for the universal health coverage for non-communicable diseases. So, I usually say that Punjab has been our Karam Bhumi, because I am working for a very long time in Punjab, and we have statewide NCD risk factor surveys done in 2015. We are running the largest cancer registry program in India as a collaboration between PGI, TMC Mumbai, partnership with the government of Punjab and Chandigarh administration, covering 51 lakh population, that is Chandigarh, Mohali, Sangrur and Mansa. Here we register almost, we have almost a network of 250 hospitals and labs of the North India which are participating in this program. And we are releasing our report regularly since 2013. We do also run a Chandigarh NCD registry, which is first of its kind in Southeast Asia, where all major NCDs are registered. Giving you some of the glimpse of the burden of problem in Punjab. So if you are shaking hand with any person in Punjab, every second person is hypertensive. Every sixth person is diabetic, right? Almost 100 cases of cancer for 1 lakh population. The prevalence of the COPD is to the extent of 6 to 7%. If you see overweight and obesity, 58% of Punjabis are either overweight or obese. And if you take central obesity, Punjabi ch kehndे gogad pei hai, khanda pinda aadmi hai na. And that way we have around 78% of our population having central obesity, right? And if you see the diabetes and hypertension, in 2015, the control rates were only 15%. It means 85% of the people were not controlled. 43% were at the risk of chronic kidney diseases. And we were surprised that why so many people are at the risk of chronic kidney diseases. And eventually the reason for this is when you have such a large number of people with untreated diabetes and hypertension, you can expect this type of risk. We compared Punjab population with the US population. Our rates for kidney diseases are comparable. And due to this risk of kidney diseases, the prevalence of proteinuria, that is protein in the urine, which is an indicator of chronic kidney disease, is to the extent of 47% in Punjab as compared to only 9% in US population, meaning thereby that, when we talk about access to the treatment, it is not there. And since the theme of this meeting is universal health coverage, it means that we have to go a long way in terms of universal health coverage. There are 3 elements in universal health coverage that you want to improve the coverage. We were talking about some of the cancers. You know, can you imagine how many people they undergo one screening of cervical cancer during their lifetime? Only 7% population. Breast cancer, 4%. Right? Oral cancer is also 7%. One time screening, I'm talking about, it means that we have to go a long way. Now, from our cancer registry experience, what we have found that, 2/3 to 3/4 of the people are reporting at a very, higher stage of cancer, stage 3 and stage 4, when there is metastasis. It means that people are reporting late, the success of treatment is going to be very low. I was listening very carefully to Madam Mangala saying that she could detect her cancer in the early phases, and she has lived almost 25 years free of any morbidity. So this is the importance of the screening and early detection program in cancer, and this is a big problem. Now, when we talk about universal health coverage, in non-communicable diseases, we talk about continuum of care. That, starting from the health promotion, that is, those who are healthy, they should remain healthy. The second step is screening, that those healthier populations should be periodically screened so that we can detect who are at the risk. Early detection, detected early so that they are put on treatment. And then we have this rehabilitation, palliative care, and eventually everybody has to die. This is called continuum of care. But if you see our country, this health promotion, screening part, and the other spectrum, that is the palliative care or rehabilitative part, are very poor. I mean, if you say we were talking about heart diseases, cardiologists are more interested in putting stent. But what will happen after stent, that is the cardiac rehab part, is very, very poor in our country, right? And we are waiting that the people should come, right? So, improving the coverage for preventive as well as, the curative services is very important if we are talking about universal health coverage. We have done the analysis of Punjab and Haryana state of total health budget and what proportion goes for preventive services. Can you guess how much they are spending for preventive services? 0.9% in Punjab and 1.2% in Haryana. This is the total health budget. And out of this 0.9%, 75% goes for advertisement, including photos of politicians. And 25% goes for printing of material, registers, and other things. So where is the budget available for preventive programs? And we say 80% of NCDs are preventive, right? So we really need to invest. And here the civil society has a role. We have calculated how much budget is required. It is just 5%. If I have to deliver the message on healthy diet, physical activity, tobacco, alcohol, stress at the grassroots level, where is the manpower? At the block level, we have block extensor educator. Dr. Gupta has been Director Health Services. How many block extensor educator who really know the definition of health promotion? But to talk of implementation of health promotion program. We have district mass media information officer. Dr. Gupta will agree with me that they are doing everything, but the work for which they are appointed. There will be some this electricity bill, the other bill, the doing the work of the officer. So with this type of manpower, you cannot expect that, this universal health coverage for preventive services. Even in curative services also, I had the opportunity to work for the task force of the Punjab Governance Commission on improving the health services of Punjab. 40 to 60% vacancies of the human resources at the level of medical officer and other allied manpower, right? So if we really want to talk of coverage of preventive and curative services, you really need to have enough human resources, as well as these preventive programs need to be resourced. Coming to the second aspect of universal health coverage is quality of services. Now, in earlier times, and when Dr. Surila or Dr. Rakesh Gupta were young, we used to go for monitoring and supervision to the services of the medical officer or the people who are working. How many officers are going for supervision and monitoring visits? You know, we have this population-based screening, whatever data is coming from the services we are taking. Now, our study says that prevalence of hypertension is 40%, but this population-based screening says it is 10%. Either we are wrong or the screening which is being done is wrong. The prevalence of diabetes from our studies is 15%. It was earlier 3%. But I do not know whether even this 3 or 10% is also correct or not, because nobody goes to visit them. Right? So these are some of the issues which are required to improve quality, and quality will come with the monitoring and so on. The third aspect of universal health coverage is that people should not have the high out-of-pocket expenditure. We are one of the notorious country, I would say, where the out-of-pocket expenditure is very high. From our study in 2015, an average Punjabi is spending 200 rupees, 2000 rupees for outpatient every month, and 11,000 rupees for indoor care for NCD patients, which is quite high. In Haryana, because we have done this similar type of work, it is 1100% for OPD consultation per month and 6,000 for the indoor. And you have in Haryana Mukhyamantri Muft Ilaj Yojana. And the other aspect here is why people are spending. They have to get the test done, which is common in NCDs. They have to buy the medicines. Punjab has 283 drugs under the essential drug list. And Haryana has almost 850 drugs under the essential drug list. But these essential drugs are on the list, but not available. So I think when we are talking about universal coverage, these issues are important. And, medical insurance is available now, but at the same, yes, so I had the opportunity to work with this Mukhyamantri Muft Ilaj Yojana for cancer, right? Cancer Rahat Course scheme. I was part of the evaluation team. I was chairing that team. 1.5 lakh rupees are available for each cancer patient for Punjab, right? Which is good enough money for the treatment at PGI or in government hospital. But if you go to the Max or to the other private hospital, I am not naming any specific hospital, their treatment. Yeah, so now at least this Ayushman Bharat is a solace for many, but we also need to see that this Ayushman Bharat scheme is not available for everyone. They are people which has come in a special survey which was done. So, you know, yes, so I mean, there are issues, as she is mentioning. You know, when surveys are done, you know, sometimes the beneficiaries are not actually the one which should have been in the list. There are many people, poor people, who are left out. So here there is the role of civil society organization. Civil society organizations are very important. And all three dimensions, we need to go a long, long way if we are talking about universal health coverage. Now, I also represent World NCD Federation. As a organization, this is a global professional association working at the global level, have its birth in PGI Chandigarh in 2015, and over a period of time we are now in Southeast Asia, Western Pacific, Latin America, Africa, Caribbean islands, and Europe. These are some of the countries which we are having our presence. We also run 3 centers of excellence: Center for Evidence-Based Research in NCDs in low middle income countries, where we conduct systematic reviews and meta-analysis for generating evidence. There is a Center for Implementation Sciences and Research with a focus on implementation research, and third is for sustainable development and health and wellness. The focus is on SDGs. We organize international NCD course every year. This year the course is from 2nd to 7th March at PGI Chandigarh. This is the 8th edition of the course, which is very oversubscribed. And I can also say that most of the state program officer of NCDs and many of tobacco are trained under this course. In the country, 50 to 60% of these people are mostly the program officer working at the district level or the state level. We organize regional meetings also. So our regional meeting for Africa region is scheduled in Victoria in Zimbabwe in the month of December. The regional meeting for the Southeast Asia will be in Kerala in the month of March for 11 countries of Southeast Asia. And as Dr. Gupta has mentioned, we also organize World NCD Congress every year, and every 3 years the third one is scheduled at Toronto in the month of June. You can visit our sites, and wherever you are interested, you can enroll. The abstract submission is open. Even NGOs, they can submit their abstract, and registration is also open. Now, if you see the structure of World NCD Federation, we have the individual membership and the institutional membership. And I'm very happy to tell this audience that many of the big NGOs are our institutional member, like Hriday is also our institutional member. The Arogya India Trust is our institutional member. Nepal Cancer Care Foundation, Bangladesh Public Health Foundation, Ghana Stroke Association in Africa. So even the Tata Memorial Center is also our institutional member. So you can see the Indian Association of Radiation Oncologists is also our endocrine society. So big association, even Indian Public Health Association, Indian Association of Preventive and Social Medicine. We publish an international journal of non-communicable diseases. So if you have any research work, and we have a special, focus on NGOs also, because they may not be writing as good as a scientific organization. Of course, there are exceptions also, so they can publish their work. At the last, I would say that this type of consultation is very important. And civil society has to play a very, very important role. Right? And that's why so many civil society organizations are out. Some of the things which we cannot say in institutions. For example, somebody should question Chandigarh administration why there are 3-4 liquor shops in every sector now. When I came to this city, and those who have lived in this city, there were only 3-4 liquor shops. The world over, the experience is if you are having a shop near of tobacco as well as alcohol, you are more likely to smoke and drink. Right? So they say that they want to earn the revenue out of it. Our gastroenterology department, they have done studies. Whatever you are earning by the revenue by way of alcohol, you are spending 2.5 times on health problems. Right? And tobacco is also an issue. Although, I mean, this is supposed to be a smoke-free city, and still people are there, right? But we all have to be aware, and definitely, yes, you are right. And uh, this is there. So I think you people are very important if we are talking about universal health coverage. We should also fight why there is so low budget. I was the member of the mission steering group of the highest body of the National Health Mission for 3 years, chaired by the Union Health Minister. I raised this issue. We are doing lip service for preventive services in this country. Why can't we ask the government to earmark 5% of the total health budget for preventive services? Here the civil society has a role. We need to be activists. People like us, we may not be, able, but, civil society organization, they can have a demonstration at Jantar Mantar saying that please spend 5% your budget on preventive services, especially for NCDs where 80% are preventive. So this is very, very important. You have seen the work of Cancer Sehata Sahayog. They are doing very good job. And patient, the last point which I would like to highlight, that NCD runs in the families. In Punjab, what we have found, when there is one case of NCD in a family, there are 70%, 5% of the families are there where there is another case of NCD. Right? It means because all these risk factors, they run in the family. Because if I am taking unhealthy diet and the lady is cooking or the male is cooking, they are cooking for whole of the family. Right? So I would say the families need to be targeted. They are very, very important. And I must congratulate Dr. Rakesh Gupta and the team and all of you for being here. And universal health coverage will be a dream without the civil society organization. Thank you very much.
Thank you so much, sir. I request Dr. S.P. Surila to please join us here and present a small token of appreciation to Professor Thakur. Next, I request Dr. Anand Gupta to please join us and provide a token of appreciation to Dr. Ravindra Khewal. Thank you, everyone. I request everyone to please assemble for a group photograph.
Subconsciously